A stroke is a life-threatening medical emergency involving the brain and the circulatory system. Around 87% of strokes are ischemic strokes. An ischemic stroke happens when a piece of a blood clot blocks an artery in the brain, cutting off blood flow. The lack of oxygen causes damage to the brain tissue downstream from the blockage. Around 13% of strokes are hemorrhagic strokes. These happen when a blood vessel in the brain bursts. Blood flows into the surrounding brain tissue, compressing it and causing damage. Bleeding can occur inside the brain itself. This is known as an intracerebral hemorrhage. Bleeding can also occur between the brain and the meninges surrounding it. This is called a subarachnoid hemorrhage. Damage to different areas of the brain during a stroke can cause different cognitive and sensory motor impairments. For example, aphasia, difficulty with language expression and/or comprehension, is the result of damage to the brain areas involved in language production and/or processing. Damage to sensory and motor cortices can cause difficulty moving or feeling sensations, often on one side of the body. Fatigue is another very common experience among stroke patients. Physical therapy, occupational therapy, and speech therapy are essential to rehabilitation after a stroke. Some risk factors for stroke include high blood pressure, high cholesterol, obesity, diabetes, and heart disease. Smokers are more likely to suffer a stroke. Age and family history can also increase a person's risk of having a stroke. What does a stroke look like to an outside observer while it's happening? And what can you do to help? F.A.S.T is an acronym used by the medical community to recognize acute stroke symptoms. B stands for balance. Sudden loss of balance can be a sign of stroke. E stands for eyes. Loss of vision or blurred vision in one or both eyes is a common stroke symptom. F stands for face. When a person has a stroke, one side of their face will often droop because of damage to or pressure on the nerves that control facial muscles. A stands for arms. Stroke can cause numbness or weakness in one arm, leg, or side of the body. S stands for speech. Slurred speech and confusion can also indicate a stroke. T stands for time. If you see someone experiencing the symptoms above, or experiencing a sudden severe headache with no known cause, call for medical help right away. In the US, that means it's time to call 911. Don't wait. The faster a person having a stroke can get the medical care they need, the better their chances of survival and recovery.